Hello everyone, it's Alicia and Dr. Dunlap here. For this week's blog, we are discussing mini implants. So Dr. Dunlap, first I want to ask you, what about them makes them mini?
Well, it's the dimension of the diameter of them. I think our traditional implants are usually 3.5 to 6 millimeters wide. These are like 1.5 millimeters wide. So the advantage is you can use them in spaces in your mouth where the bone width isn't quite as wide.
Okay, so what typically is, the main reason that people choose to go with mini implants versus traditional?
Yeah, good question. And I think the real reason is cost mostly, okay? And the mini implants, because the surgery is a little different, a lot of times we don't have to do the grafting step where, the ridge is a little narrower. It's a simpler surgery. Our cost is probably a third to half of your traditional implant. So the cost is a big deal. That all implants work, okay? And I think the big advantage for implants is for people that have been wearing denture paste, okay? Implants are just tremendous for that. I mean, those people are just, they couldn't be happier usually because it just allows them stability to chew that they've never had.
Okay, so can you tell me how long they last as opposed to traditional implants?
Yeah, I think it's comparable, but however, physiologically, you got to understand because they're smaller, you don't have as much bone around them, so they can break down a little easier. So you have to be very careful. Oftentimes, we'll put in more implants to supplement that possibility, but I think it's still functional and it gives patients an option maybe to get into something that's like an implant supported denture at a lower cost.
All right. Well, my final question for you is just, are mini implants appropriate everywhere in the mouth?
Yeah, I think that's a good question too. I think all implants are bone driven, so it depends upon the amount of bone that you have. What happens when you lose a tooth primarily is you lose probably 60% of your bone. And so it makes it more difficult to place implants. And the mini implants oftentimes, if a ridge is fairly narrow, which a lot of them are, if you've had a denture for a long period of time, it does allow us to use those in those situations a little easier. So, I think they do work. I think there's a place for them. And again, I'd love the opportunity to share with people, one-on-one what we can do.
Okay, wonderful. Well, you heard him. If you're watching this video right now and you are interested in meeting with Dr. Dunlap one-on-one to ask more questions and to learn a little bit more about mini implants and your options, you can schedule an appointment by giving the office a call. Also, make sure you're exploring the rest of the website, coshoctondentistry.com, and all of their social media channels where you'll be able to catch our weekly blogs. Thanks so much for watching.